Endometrial cancer begins in the uterus, specifically in the lining called the endometrium. This cancer is a significant health concern for women globally. It is the most common cancer of the female reproductive system in many developed countries. Each year, many women are diagnosed with endometrial cancer. While it can affect women of any age, it is most often found in women after menopause. Awareness is the first step towards fighting this disease. Early detection often leads to better treatment outcomes. If cancer is found before it spreads, it is usually easier to treat successfully. Many women may not recognize the early warning signs or might delay seeing a doctor. Educating the public helps to change this. It empowers women to take action for their health. Understanding endometrial cancer helps us support those affected. It also guides efforts in prevention and research. When we know more, we can do more. This includes making healthier lifestyle choices. It also means supporting research for new treatments. The goal is to reduce the number of women affected by this cancer. Knowledge is a powerful tool in our collective health efforts. Several factors can increase a woman's risk of developing endometrial cancer. One of the most significant is obesity, which can lead to higher estrogen levels. Estrogen can stimulate the growth of the endometrium. Hormone imbalances play a major role. Conditions or treatments that increase estrogen levels without enough progesterone can raise the risk. Genetic factors can also contribute to endometrial cancer risk. Lynch syndrome is an inherited condition that increases the risk of many cancers, including endometrial cancer. A strong family history of endometrial, ovarian, or colon cancer might suggest a genetic link. Genetic counseling and testing may be recommended for some women. Other factors include age, as most cases occur in women over 50. A history of never having children is also a risk factor. Starting periods at an early age or experiencing late menopause extends estrogen exposure. Diabetes is another condition linked to a higher risk. Understanding these risks helps in taking proactive steps for health. Early detection of endometrial cancer significantly improves the chances of successful treatment. When the cancer is found at an early stage, it is often confined to the uterus. This makes it easier to remove completely with surgery. The 5-year survival rate for localized endometrial cancer is very high. The most common symptom of endometrial cancer is abnormal vaginal bleeding. For postmenopausal women, any vaginal bleeding is abnormal and should be checked by a doctor. For women who have not yet reached menopause, abnormal bleeding includes very heavy periods or bleeding between periods. Other symptoms can include pelvic pain, a feeling of pressure in the lower abdomen, and pain during sexual intercourse. Some women might notice an abnormal vaginal discharge that is watery or has blood in it. Changes in bowel or bladder habits can also be warning signs. It is vital not to ignore these symptoms. Prompt medical attention can lead to an earlier diagnosis. This gives the best opportunity for effective treatment. Early action is a key part of protecting your health. When symptoms suggest possible endometrial cancer, doctors use several methods to make a diagnosis. The first step is usually a medical history review and a physical exam, including a pelvic exam. A transvaginal ultrasound is often one of the first tests performed. It uses sound waves to create pictures of the uterus. The doctor can see the thickness of the endometrium. A thickened endometrium can be a sign of cancer or other conditions. A pap smear is not a reliable test for endometrial cancer. The most definitive way to diagnose endometrial cancer is through an endometrial biopsy. This procedure involves taking a small sample of tissue from the endometrium. It can often be done in the doctor's office. The tissue is then examined under a microscope by a pathologist to look for cancer cells. Sometimes, if a biopsy is not conclusive, a procedure called a dilation and curettage with hysteroscopy may be performed. The primary treatment for most women with endometrial cancer is surgery. The most common surgical procedure is a hysterectomy, which involves removing the uterus and the cervix. Often, the fallopian tubes and ovaries are also removed. During the surgery, the doctor may also remove nearby lymph nodes to check if the cancer has spread. Radiation therapy is another common treatment for endometrial cancer. It uses high-energy rays to kill cancer cells or stop them from growing. Chemotherapy involves using powerful drugs to kill cancer cells. These drugs travel throughout the body and can reach cancer cells that may have spread beyond the uterus. The choice of treatment depends on several factors, including the type and stage of the cancer. A team of doctors will work together to develop the best treatment plan for each individual. It is important to discuss all options, potential benefits, and side effects with your healthcare team. Beyond traditional treatments, new therapies are offering hope for endometrial cancer patients. Hormone therapy is one such option. Some endometrial cancers are sensitive to hormones, particularly estrogen. Hormone therapy aims to block the effects of estrogen or increase progesterone levels. Targeted therapies are another exciting area of development. These drugs work by attacking specific molecules involved in cancer growth. Researchers have identified several genetic mutations and molecular pathways in endometrial cancer. Drugs are being developed to target these specific changes. Immunotherapy is revolutionizing cancer treatment, including for endometrial cancer. These therapies work by helping the body's own immune system recognize and fight cancer cells. Checkpoint inhibitors are a type of immunotherapy showing promise. For endometrial cancers with specific genetic features, immunotherapy can be particularly effective. Clinical trials are crucial for advancing these new treatments. They test the safety and effectiveness of new drugs and treatment combinations. Participating in a clinical trial can give patients access to cutting-edge therapies. The landscape of endometrial cancer treatment is constantly evolving. These newer therapies offer more personalized and potentially more effective options. Always discuss with your doctor if these emerging therapies are suitable for you. While not all cases of endometrial cancer can be prevented, certain lifestyle choices can significantly lower your risk. Maintaining a healthy body weight is perhaps the most important step. Obesity is a major risk factor because fat cells produce estrogen. Eating a balanced diet rich in fruits, vegetables, and whole grains is beneficial. Limiting processed foods, sugary drinks, and red meat can also help. Regular physical activity is key to managing weight and overall health. Aim for at least 150 minutes of moderate intensity exercise per week. Managing other health conditions is also important. Women with diabetes have a higher risk of endometrial cancer. Good blood sugar control can help mitigate this risk. If you have polycystic ovary syndrome, work with your doctor to manage the condition. If you are considering hormone replacement therapy after menopause, discuss the risks and benefits thoroughly. Regular medical checkups are vital for early detection and prevention. This includes routine gynecological exams. For women at high risk, more frequent screening or preventive measures might be recommended. Open communication with your healthcare provider is essential. Being vigilant about your body and reporting any unusual symptoms promptly is crucial. Early diagnosis makes a significant difference in treatment outcomes. Research into endometrial cancer is rapidly advancing. Scientists are learning more about the different molecular subtypes of this cancer. Not all endometrial cancers are the same. They can have different genetic mutations and behave differently. Understanding these subtypes helps to predict how a cancer might grow or respond to treatment. This knowledge is paving the way for more personalized medicine. Treatment plans can be tailored to the specific characteristics of an individual's tumor. One exciting area of research is the development of new targeted drugs. As we identify more specific molecular targets in cancer cells, new therapies can be designed. Clinical trials are constantly testing these new agents. Liquid biopsies are another area of focus. These are blood tests that can detect cancer DNA or cancer cells circulating in the bloodstream. Personalized medicine is the future of endometrial cancer care. This means moving away from a one-size-fits-all approach. Treatment decisions will be increasingly based on the unique genetic makeup of the patient's tumor. Researchers are also working to improve the quality of life for endometrial cancer survivors. The progress in research offers great hope. We are moving towards more effective, less toxic, and highly individualized treatments for endometrial cancer. The journey through understanding, preventing, and treating endometrial cancer is one of empowerment. Knowledge is your strongest ally. By learning about this disease, its risk factors and symptoms, you can take proactive steps. You can make informed decisions about your health and lifestyle. Remember that many risk factors are manageable. Simple changes like maintaining a healthy weight and staying active can make a real difference. Early detection remains a cornerstone of successful treatment. Listen to your body. Do not dismiss unusual symptoms, especially abnormal vaginal bleeding. Seeking prompt medical attention can lead to diagnosis at an earlier, more treatable stage. Encourage the women in your life to do the same. Open conversations about women's health issues help break down barriers. The advancements in treatment offer tremendous hope. From surgery and radiation to newer therapies like immunotherapy and targeted drugs, the options are expanding. Research is constantly uncovering new ways to fight endometrial cancer more effectively. Ultimately, taking charge of your health journey is a powerful message. Be an advocate for yourself. With increased awareness, continued research, and proactive health management, we can face endometrial cancer with greater confidence and hope.